Today we are going to see some not very commonly discussed urinary problem which is called as urinary incontinence. Hello everyone, I am Dr. Archana. I am a nephrologist working at Renova Hospital, Kompally. Urinary incontinence means involuntary passage of urine. So, it can happen in males as well as in females. It is a very common problem in the society, but due to embarrassment or due to some lack of knowledge, it is not discussed openly. So, the patients do not come to the doctor with these problems. I would like to share two videos which are separate for the urinary incontinence for males and for females, because the causes are different for both these gender. First, coming to the first topic, urinary incontinence in males. So, what urinary incontinence is the involuntary passage of urine, means patient unknowingly or even without control patient passes urine. So, he cannot control it. So, why this happens? We will see that. As we age, there is some aging process which is happening in the body. So, there are certain abnormalities happen in the body which leads to even this kind of abnormality of urination. So, though many of the patients take it as a part of normal aging, but let me tell you, it is a pathological thing and it is not a normal part of aging. Even a healthy aging will not cause urinary incontinence. So, what are the types? So, commonly discussed types or commonly seen types are: first is urge incontinence, and the second is stress incontinence, third one is post void dribbling, fourth one is the functional incontinence. So, we will see what is urge incontinence. Urge incontinence means patient has an urgent need to pass urine. Patient gets up from the position from wherever he is sitting or lying down, wants to rush to the toilet, wants to pass urine, but in halfway or midway or at the door of the washroom, patient passes urine involuntarily, it starts leaking, and this is called as urge incontinence. That means there is an urgent need to pass urine and there is no much time given for the patient's body to control it, and the patient just passes it in midway or halfway. The second is the stress incontinence. Stress incontinence means whenever patient or a person laughs, smiles or coughs, sneezes or anything which increases the intra-abdominal pressure, there is a leakage of the urine which he cannot control. So, this is called as stress incontinence. The third one is post void dribbling. That means patient passes urine, but the urine starts coming again even after finishing the act of urination, which soils his undergarments or pants. So, this is very embarrassing for the patient when he is in the office or outdoors and doing some activity. So, that is what is post void dribbling is. Functional incontinence is there is some problem because of which the patient is bedridden. Because of the decreased mobility, there is some time taken for him to reach to the washroom or the toilet. So, meanwhile patient, because it is the time duration itself is delayed, patient passes urine in between. Another specific category in male patients is after the prostate surgery. So, after prostate gland surgery, there is incontinence which happens in some patients. So, we will see how to go about it. So, these are the types of the incontinence. Now, let us see like what are the causes of incontinence. In males, particularly in males at early ages or in adulthood, so there is no problem of incontinence usually. So, as the age advances, there is this incidence of incontinence keeps on increasing when the patient is more than 60 years of age. This is what is as per the studies or research. There is a prostate gland in males which is present near the urethra. So whenever the patient, as the patient age, the size of this gland also keeps on increasing, and it pushes or presses on the bladder neck or on the urethra. So that causes sudden urinary abnormalities for these patients. So this is one of the major important cause of the urinary incontinence in males. Apart from that, there are other causes like neurological abnormalities like Parkinsonism, dementia, due to which also this problem happens, strokes, this problem can happen. Uncontrolled sugars can also lead to involuntary leakage of the urine because they cannot control it. Urinary infection, again the same thing, urinary infection leads to irritation of the urethra, and then the patient has to pass urine immediately. This frequency increases. As well as there are certain medications like diuretics, as well as there are other antipsychotics, antidepressants, and there are certain other medicines also which can cause urinary incontinence. Also there are some bladder problems, like bladder is the organ which receives urine from the kidney. So if they, and it releases it in the periodical manner whenever the bladder pressure goes up above particular level. So whenever this bladder functioning is affected because of any reason like neurological problems, uncontrolled sugars, blood, long-standing diabetes. So these are the things which can cause the nerve problems to this bladder. So that also leads to the retention of the urine and not able to pass urine, or suddenly passing urine but not able to control it. So these are the bladder dysfunction, various bladder dysfunctions which can cause urinary incontinence. Also abdominal masses like any cancerous big lesions in the abdomen or any metastatic lesions in the abdomen can irritate the bladder, and the patient is not able to control the urine and it passes immediately. So these are certain causes of the urinary incontinence in males. Let us see what are the risk factors. As we discussed, the risk factors, the common risk factors are age itself, aging itself is a risk factor for it. Second thing is about uncontrolled diabetes, uncontrolled hypertension, patients having habits of alcohol intake, excessive caffeine intake, that is coffee intake, or smoking. So these are certain risk factors which can aggravate this problem. So first and foremost thing is, whenever you have this kind of complaint, better to meet the doctor. So your doctor will take the history in detail. So there could be multiple reasons behind it. So we need to find out what reason a particular patient has. So detailed history is very important. So not to hide any point from the doctor, so that he or she can come to a proper conclusion with the history. Then next step is the investigation, doing the urinary tests to rule out any infection, any other urinary problems. Apart from that, doing the ultrasound scanning, checking the bladder capacity, checking the prostate size, checking whether there is any other abdominal issues. So after these are the tests which are done. So after the history and clinical examination, the doctor will decide which tests are needed. It's not like all panel needs to be done. As per the history and the examination, particular tests will be advised to you. And then depending on the results and depending on the diagnosis, the management will go on. But important factors in the management is the lifestyle modification. Like if you have diabetes, better to have a good control of diabetes, so that the chances of uncontrolled sugar leading to incontinence is less, as well as the chances of infection are less. So the first thing is control of blood sugar. Control of blood pressure is also equally important. Whatever medications you are taking, do get it reviewed by the doctor in case you are having this kind of issue. Third thing is quit smoking in case patient smokes, stop alcohol or reduce the alcohol intake, particularly avoid it in the large quantity binge drinking is to be avoided. Smoking has to be stopped. Try to maintain or gain your ideal weight, so that obesity has to be eliminated completely, which obesity also contributes to this incontinence. To improve the lifestyle or to improve the quality of life, better to wear diapers or the padded undergarments, so that it is the patient does not feel embarrassed or does not restrict himself or herself from going to from mixing in the people or mixing in the society. So that can also lead to major complications like depression if you withdraw from the society. So it is important that you are able to mix up with the society with free mind by using the diapers. There is something called as bladder training. So if the patient is having this issue, the patient is trained to pass urine in a particular way, so that he can pass it once, then wait for some time, again pass the urine in the washroom itself, so that he does not have this post-void dribbling, or even after some time again patient has an urge to pass urine. So these problems can be avoided. So bladder training is important. So these are some important points about urinary incontinence in males. So concluding that, it is not a normal part of aging. If you have any urinary incontinence, do meet our doctor. Second thing, if you have any high risk factors, always pinpoint the risk factors and the precipitating factors like caffeine or alcohol or smoking, and then it is easier to manage this thing. Don't hesitate to wear diapers and mix up in the society, so that you are active and remain physically active throughout your life.